Hey everyone, Ashutosh Jadhav here. Welcome to the third episode of my talk series. Today's topic is going to be depression. Depression, the leading cause for the recent suicides in India. And let's see what depression is in real sense. It's going to be explained by Dr. Iwa Bhattarai.
Hello and namaste everyone. This is Iwa Bhattarai. I am a medical student at Kathmandu University School of Medical Sciences, and today we'll be discussing about depression. According to the American Psychiatric Association, depression, also known as major depressive disorder, is very common and serious medical illness that affects how you feel, the way you think, and how you act. Depression is a persistent feeling of sadness and loss of interest in activities that were once enjoyed by an individual, and it lingers for a period of 2 weeks and sometimes even months. Depression can lead to a variety of emotional and physical problems and can decrease the person's ability to function at work and sometimes even at home. Depression is totally curable. Before moving on to the topic proper, I would like to present you some facts about the mental illness and depression. Depression is a common mental disorder. Globally, around 264 million people of all ages suffer from depression and is a leading cause of disability worldwide, and is also a major contributor to the overall global burden of the disease. It is estimated that 1 in 15 adults suffer from depression in a particular year, and 1 in 6 people suffer from depression at some point in their life. Depression can occur at any age, but first episode is mainly seen during the late teens or mid-20s. Also, it is estimated that women are more prone to depression as compared to males. Around one-third of females have a major depressive episode at some point in their life. Close to 8 lakh people die every year due to suicide, and every 40 seconds someone loses their life due to suicide, and this is the second leading cause of death in 15 to 29 year age group. Data shows that in low and middle income countries, around 76 to 85% of people do not receive any treatment to mental illness and depression, and the barriers being social stigma, lack of education regarding mental illness and mental health, and lack of professionals and lack of professional care. And it is very important to differentiate depression from sadness or grief. Loss of a loved ones, ending of a relationship, loss of job, or any kind of stressor is a difficult situation for a person to endure. It is normal to be sad in this kind of scenarios and withdraw yourself from day-to-day activities. Those experiencing loss often describe themselves as being depressed, but depression is much more than just being sad. In grief, painful feeling comes in waves, often intermixed with positive memories of the deceased, and rational conclusion is drawn at the end, and self-esteem is usually maintained. But in case of depression, the mood and interest are decreased for 2 weeks and sometimes even more, and feeling of worthlessness and self-loathing is so common. Despite some overlap between grief and depression, it is extremely important to differentiate between these two terms, and it is extremely important to distinguish between them, to seek help, to determine the treatment modalities further. So let's talk about the risk factors for depression. Depression can affect anyone. Any person who is living in a relatively ideal scenario can suffer from depression. Depression has no face. It can affect anyone. There are several contributing factors that play a major role in depression. The number one being biochemistry. There are differences in certain chemicals in the brain that we call as neurotransmitters. The recent research indicate that changes in neurotransmitter and the effect of this neurotransmitter and how they interact with the neurocircuit in the brain are involved in maintaining mood stability and have a significant role in depression. And this circuit can be studied for the treatment purpose further. The next one is a genetic. Depression can run in families. There can be a positive family history. The study shows that if one identical twins is suffering from depression, there is 70% chance that the next will suffer from depression at some point in their life. Personality. The people having low self-esteem or who are easily overwhelmed by stress or who are generally pessimistic are more likely to suffer from depression. Other is environmental factor. Continued exposure to violence, neglect, poverty, abuse can make some people vulnerable to depression. And also hormones, the change in balance of certain hormones in the female body, especially during pregnancy or after delivery, which is also known as postpartum depression, from thyroid problems, or sometimes during menopause or other medical conditions can trigger depression. And sometimes there is not a particular risk factor or not a particular cause also. So let's talk about the symptoms of depression. It can be mild, moderate, or severe and varies from person to person. There is intense feeling of sadness, emptiness, tearfulness, hopelessness, and constantly depressed mood is present. There are anger outbursts, irritabilities, frustration even in small matters that we should normally let go. There is loss of interest and pleasure in activities that were once enjoyed by the person. There is change of appetite. There can be weight loss or weight gain which is unrelated to the diet that the person is consuming. There is trouble sleeping. Either he is sleeping too much or he is sleeping too little. There is loss of energy. There is increased fatigue. There is increased purposeless in physical activity. There are slowed movement and speech which is normally observed by the close persons or family members. There is feeling of worthlessness or guilty inside the person. There is difficulty in thinking, concentrating, making decisions, and the symptoms are so vague and they consume the person so much that they turn suicidal. The symptoms must last for at least 2 weeks for the diagnosis of depression. Also, medical conditions such as thyroid disorder or vitamin deficiency or tumors can mimic the symptoms of depression. So it is very important to rule out these conditions from the clinical depression, and for that the thorough physical and history taking is extremely important. Depression is a real illness and help is totally available. With proper diagnosis and treatment, a vast majority of the people will overcome it. And if you are experiencing any symptoms of depression, the first step is to see your therapist or counselor and tell them about your concerns, your insecurities, and ask them for thorough evaluation. And it's the first step to start addressing your mental health needs. Different treatment modalities are available, and the first being medication that normally tricyclic antidepressant and SSRIs are generally prescribed. Brain's biochemistry may contribute to the individual's depression. Antidepressants are prescribed to help modify the brain chemistry. They are not habit forming. Antidepressant may produce some improvements within a week or 2 weeks of using it. If a patient feels little or no improvement after several weeks, doctor can alter the dose of the medication or add or substitute any other antidepressant. In some situations, psychotropic medications may be helpful. Psychiatrists may recommend the patient to continue medication for 6 months or more after the symptoms have improved, and it is also dependent on the severity of the depression. In some patients, the medical therapy may be suggested to be continued for a long time to prevent the future depressive episode. Such in that is only prescribed for a long-term therapy. Next is psychotherapy or talk therapy. Psychotherapy or talk therapy is used alone for a treatment of mild depression. For moderate to severe depression, it is used along with antidepressant medications. Cognitive behavioral therapy has been found to be effective in treating depression. It is a form of therapy focused on the present and problem thinking. Cognitive behavioral therapy helps to recognize the distorted thinking and changing behaviors and taking small steps to change it by rational thinking. Psychotherapy may include the individual, but it can include other family members, or couple therapy can also be done to address issues in those close relationship. Group therapy involves people with similar mental illness. Depending on the severity of the depression, treatment can vary from few weeks to much longer period of time. In many cases, significant improvement is seen within 10 to 15 sessions of psychotherapy. Or the next is electroconvulsive therapy, or ECT. It is not commonly used, but in case of a patient having severe depression or bipolar disorder, or people who have not responded to any other treatment modalities, it can be used. It involves a brief electrical stimulation of brain when the patient is under anesthesia. A patient typically receives ECT 2 to 3 times a week for a total of 6 to 12 treatment. ECT has been used since 1940s, and many years of research have led to the major improvement. It is usually managed by a team of medical professionals, including psychiatrists, anesthesiologists, nurse, and physician assistant. Last and the most important modality is self-help and coping. There are a number of things that people do to help reduce the symptoms of depression. For many people, regular exercise, yoga, meditation helps create a positive feeling and improve the mood. Getting enough quality of sleep on a regular basis, eating healthy diet, avoiding alcohol, which acts as a depressant, can also really help reduce the symptoms of depression. I request you to make a habit of sharing your feelings to whoever you feel comfortable about. I know it's not easy, but you can always try. Seek within. You have whole universe inside you. Accept and let go all the negative energy that you are holding. And to everyone hearing this, be kind and empathetic to people. Depression is not a battle of an individual, it's a battle of the family, it's a battle of the community. So create friendly and loving environment. Be kind to even smiling faces, because depression has no face. Help them, reach out, check on them time to time. And if you are feeling that you may harm yourself, or you are feeling suicidal, then you can always reach out to people and call in the suicide helpline numbers in your respective place. Work to break this stigma and take initiative in whatever ways we can. Create a healthy and friendly environment to people, so that they can come to you and they can share things with you. And it's a long process, but together we can make a difference. Thank you.